I don't know if, I mean, I can look further. I know that Bill's raised in Massachusetts.
I don't know if I need this one because I have one already, right?
Yeah, I think I would just.
Just in case.
But I don't think probably has. But it wasn't, it didn't, like, it wasn't enough pressure. Like, which got watered down and then processed. And then it's like, yeah, that's a dream for us.
Check, check, check.
I know we're doing good.
They can't hear. Is your mic on? It went back off.
Oh.
Can, can you hear me now? Okay, thank you. It's echoing. If somebody has their computer on, can they mute themselves? Good afternoon. Let's just do that. Oh, it's not my microphone. It's someone else's. Well, good afternoon. There's a little bit of an echo in here. I don't know exactly what's going on, but hopefully you can hear me now online. Thank you so much for being here for our March TCB meeting. And we have plenty of folks online as well. Senator Marr can't be with us today, but you're still in good hands with Claudio and myself. And so we'll work our way through, and very excited about what this meeting represents and that we will be going through our strategic plan. So Claudio, do you have any comments?
Just to welcome folks and excited to dig in, and also want to recognize one of our own, Howard, who has been nominated to be the behavioral health advocate and had a really successful nomination meeting. And we're hoping to see that move forward. And as the tri-chairs have already discussed, we'll make sure that you're statutorily still stuck with TCB. So we'll pull you back into that work, Howard.
That was a very early part of our discussion. That was a part of it. So congratulations. We're so happy about that. And so I'll turn this over to Erica for the minutes.
Yeah, thank you, everybody. Good afternoon. Erica Nowakowski, Executive Director of the Tau Youth Justice Institute, and just very excited for this day. I have a disclaimer. If you see me a little bit nervous, it's because I have several bills in the other room in a public hearing right now. So there's a very full house over there. So my staff is also over there. But thank you, everybody. Just a couple of housekeeping we'll take questions at the end once we have a pretty hefty presentation. So we want to take questions at the end. So please reserve your questions till then. Before we get started, we have some approve the February TCB meeting minutes. Before we begin, is there any changes or revisions? No, seeing none, can I get a call to accept the meeting minutes for the February 2025 TCB meeting? Okay, second.
I'll second it.
Okay, thank you. Okay, and actually, any opening remarks from the chairs about the TCB strategic plan, or would you like us to just dive in?
Were we going to do the legislative updates?
Legislative updates.
I'll do that and then turn it over to you. We're very excited to get started on that piece. Just to review some legislative updates, we have recommendations. It's House Bill 6951. We had a public hearing on February 20th through the Children's Committee. And on March 12th, it was sent to the Appropriations Committee. This bill includes the Crisis Continuum Study recommendation, school-based health center study, and funding for mobile crisis recommendation. House Bill 7109 was referred out of the Children's Committee and to the Human Services Committee. It had a public hearing on March 6th and filed with Legislative Commissioner's Office on March 19th. This bill included our recommendations regarding amending the age of insurance coverage for ABA, applied behavioral analysis therapies for individuals with autism spectrum disorder, the UCC study, the ICAPS recommendation, and the design of the CCBHC planning grant. And so we're going to and also, just so you know, just look out for any additional updates. And there is also an issue brief that we have as well that Tau put together called Understanding the 2025 Transforming Children's Policy Health, Behavioral Health Policy and Planning Committee, our recommendations. And it gives you a little bit more background and information as well. So thank you so much for that. And with that, we're ready to move on to the strategic planning.
All right. And thank you. You have us and our co-chairs of the work groups as part of your presentation today. No other agenda item. And before we begin, I want to just, in your packet, and also it is material that was sent out via email by Emily, and will also be posted on the TCB Connecticut General Assembly website, as well as you could even reach out to us if you didn't receive it. Reach out to us. But in your packet, we did not. It is an 80-page document, so we did not print out the strategic plan at this moment because it continues to be in draft. We will be giving you all a hard copy because I still believe, sometimes like papers feels good sometimes, but a hard copy once the strategic plan has been adapted in April. But for today's purposes, what you do see in your packet is there is our hope is to keep the strategic plan in draft for an open for feedback. And then we will, at the April 16th TCB meeting, we will be voting to adopt the plan, and we will go over any of the modifications and so forth. In your packet also exists, and as we go through the presentation, you'll see, but also exists the work plan for 2025 for each of the work groups. There is the annual work group meeting schedule. Please, if you have interest in attending any of these work groups and or know anybody or any other entities that would like to participate, we are still reaching out to organizations, but we have our new 2025 work group schedule. And in there, in the packet is also a list, which we will go over today, a list of all the 2025 studies. And lastly, is a document, a pretty hefty document of we did our homework and due diligence in reviewing several advisory bodies that core focus is on children. And so you will see a document that's focused on some of the output information that we obtained while having not only reviewing all these different committees and task force, but also having meetings with several of the chairs of these committees and task force. And then lastly, as Representative Exum said, is the issue brief on the 2025 recommendations. So with that being said, we will dive into the official presentation. Just quick update through this. I think Emily is. Oh, and sorry. And one of the members, or not members, one of the consultants on our team, which you may have seen his face in various Zoom meetings or in various TCB monthly meetings, but yet he's been in the background. He has not necessarily chimed in. He's been listening, and I'm going to give him the floor to introduce himself and talk about what he has, his role in this work for the past year, working with us at the Tau Youth Justice Institute, and also conducted some focus groups with some of you that you were invited to attend. Antonio, I'd like to give you the floor. He is on a virtual screen, virtually for today. I'd like to give you the floor to introduce yourself and introduce the first slide. Thank you.
Okay. Hi. Thank you, Erica, and hello, everyone. It's nice to see you. As Erica said, I'm Antonio Aiello, and I'm a consultant, and I was brought on as a narrative strategist and strategic planner to help TCB go through this strategic plan. And one of the things that I do, I've been doing this for about 10 years, and I usually work with major nonprofits, advocacy, and arts organizations, is to bring in an outsider perspective on whatever work is being done. And so with TCB, I sat in on meetings and workshops, and I kind of dove into all of the materials and research and data that I could find. And my job was to take a look at a really complex landscape of behavioral health services in Connecticut and a pretty rich history of services and of initiatives, and to help TCB come up with a strategic plan that went past the data and went past all the research to tell the story of a really compelling and really important initiative with TCB to take a new look at the behavioral health services. So with that, I did sit in on focus groups. I met with the tri-chairs and the co-chairs of the Infrastructure and Services Committee. I had a chance to ask people questions that kind of went past the normal business scope of business, to see what drove them personally, to see to check in about their personal experiences and to really get at the different ways that we're driving the work. I also had the chance to meet with several other groups to hear directly from some of the parents and kids who have received services and who are in the system, and also with agencies and organizations. And through all of this, I think my job was really to try and get a really complicated, layered story about behavioral health services in Connecticut, and to be able to tell it compellingly and to get at the deep passion and need for reform, and to be able to put that into a document that could be both a guide and kind of a bar by which everyone could measure the work going forward for the next 3 years. And I hope that's what we've been able to do. And with that, I'm going to let Erica take it from here. It's been an amazing experience to see how this group has come together and worked so passionately over the last year to really put this together.
Thank you, Antonio, and thank you for all the great work and always checking in with us and moving us forward. So really appreciate this. And so as Antonio mentioned, this has been a full year's worth of work. We literally started, I believe, our first official meeting. We had already given you all a survey to complete. What were some of the things that you identified in the system that were or were not working? What are some of the areas of priority? That was, back in the fall of 2023, because remember, July of 2023 is when we had our first meeting. So it was the fall of 2023. And then from there, some of the decisions we made through our some of those surveys is that we needed to do some level setting. We still needed to better understand. For some of us, this was new work, and for others, we've been in the work for a very long period of times, but wanting to better understand what the landscape looked like today, and also hear from multiple diverse voices, right? And but before we can really dive deeper, we needed to understand the system, and we needed to understand what the needs were and what the gaps were, and also understand the strengths in our own system. And so we did have some level setting. I didn't note it here, but we did have a level setting training at Middlesex Community College for those of you who were able to join us. A full day of level setting. We had some of your own co-chairs, Alice and Edith, no, not Edith, Alice and several others, CHDI, and present to this group on various parts of the continuum of care. Also present, Dr. Michael Powers presented around disabilities and, what does that mean and so forth. So a lot of level setting early on, which was very important for this committee. And no matter where you are in the field, it was very important. It also gave us an opportunity to get to know each other. Some of us have been working together for a very long time, but in different spaces. This kind of work is different. It's significantly different. And so when we're talking about policy and committee work, and so it gave us an opportunity to get to know each other and come up with some agreements for this work. In June of 2024, we also went back to Middlesex Community College, and we did some more about identifying priorities and what are the priorities? What are some of the, how would we rank those priorities and so forth? Just brainstorming, throwing things, and we had the walls, if you all remember, covered in paper, and really identifying what do we mean by the crisis continuum? What do we mean about, in-home services? What do we mean about Medicaid? It's very complex, right? And so we threw out, we got into groups, as you see in the pictures here, we got into groups. It was very interactive and a lot of reporting back around these areas. And so, and we enjoyed a good lunch. So, and then, again, we engaged you all for a luncheon meeting in July as well, at one of the Hartford libraries. And there we talked about ranking things and spelling out more about the strategies, just further narrowing, right? Because there's a lot of information in all of this. We can go down the line. We did those twice, and then we had a virtual session where we, if you fast forward to the next one, so here is where we ranked, and they just took a picture of some of this is one example within the middle picture there in the screen about the various areas of strategies and that you all identified, whether it was in workforce, whether it was in data, whether it was in governance, so forth. Just lots of notes were taken. And I just want to also thank my team, because not only the students, but my staff have gone through as piles and piles of notes, from the surveys to the actual written notes. We got copies of paper that you all gave us, sticky paper and so forth, sticky notes and everything. And they've gone through and really just, tried hours and hours of just sifting through all those notes and trying to organize them. And then if we move forward to the next slide, thank you. Those notes, the last virtual session led to who do we need at the table? So here's all these priorities. Here's the parts of the systems that we really want to focus on, but who do we need at the table? This committee is formed, I think the last count was 51. Once we add the behavioral health advocate, will be 52. Will be, it's a very good representation of the system, but that's not the full system. That's not everybody. That's not all the different partners that are working in this field and interact with our children and families. So who do we need at the table? And then something even more critical is beyond the priorities, is the strategies and so forth. In order to be successful in implementing these strategies, we need to better understand, or even getting it through a legislative process, we need to understand what the data tells us. So what information other than best practices, but what other information about Connecticut do we need? So not only, and who do we need that from, right? So it's a lot of stuff: who, what, when, and how. And so we spent a virtual session making those decisions. You all brainstormed away and gave us some more information there. And we have, through that, developed an 80-page document, which is your 3-year strategic plan. I'm going to give the floor to Emily. She and I will be toggling back and forth in this presentation, but I'll give the floor to Emily now.
Hello, everyone. I'm going to go over the committee structure chart, as I know it's kind of progressed over the past few months. So when this committee was formed, we discussed adding a data and funding work group, which you will see stemmed out of system infrastructure. Within the strategic plan and in the work group work plans, you will see that most work groups are touching upon data and funding. We can utilize the data and funding work groups to answer additional questions that the work groups might have. The Community Voices work group will be introducing themselves to the committee in April. This consists of 3 providers that we have so far: Love 146, Favor, and Full Circle. Love 146 touches upon statewide, so does Favor, and Full Circle does Bridgeport. We are looking to add more organizations within this Community Voices work group. The strategic planning work group will be sunsetted after the April meeting where we adopt the strategic plan. And the ad hoc committee is going to be created to anticipate federal policy changes. And Claudia can speak more about the ad hoc committee.
Sure. Thanks, Emily. I think that it's prudent for us, with the very fluid federal landscape, that we have an ad hoc committee for rapid response. If there's a change that we need to recalibrate to, that will be sort of our standing ability to organize and collect how the impact may be for children's behavioral health, and our provider network. So we just thought it would be wise to put that committee there and see how things materialize. Thank you.
Thank you. So the next page is the mission statement. This was a collaborative process that was voted on through surveys through the whole committee. Just to touch upon some key point, TCB is a bridge builder that will engage system-wide stakeholders, use data to assess gaps in system inefficiencies, identify cross-system alignment, and make recommendations that address and overcome the root obstacles in order to promote the well-being and resilience of all children and families. So looking at the goals, strategies, priorities, and objectives, within the strategic plan, you will see priorities, strategies, and objectives. The priorities are the key areas of focus. So those are the funding, the governance, the data, the workforce. The strategies are the action steps needed toward achieving that goal, and the objectives are the intention of each work group. After listing all of the priority strategies and objectives within the strategic plan, you will see charts that touch upon the goals, priorities, and objectives. These charts list partners and information needed, outputs, and measures of success. And these charts summarize the data that Erica spoke earlier on from all of the strategic planning work group sessions.
Thank you. One other thing that just was every time it seemed every time we met, every time we had a discussion about TCB and its work and how we're going to move forward, there was something that just kept coming up as themes, major themes. And that was, around special populations, whole family, and multi-system approach. And one thing which I find not only in this committee, but in other committees that I've worked in, is that at the center is our children. And our children are not one system involved. They're multi-system involved. So in order for us to be effective in this work, we're not just talking about one system. We're talking about impacting all of those systems that interact with our children and families. So this, as we were listening to all this feedback and going back through all the notes, what we identified was that there was an overarching framework for this work. And in that overarching framework was these, that at the end of the day, everything that we do will be, whether it be in infrastructure, whether it be in services, whether it be in school-based, whatever it may be, we have to keep in mind the multiple systems that interact in infrastructure, the multiple systems that interact in data, the multiple systems that interact in school-based. It's all of that, because we're not just talking about one. We're also talking about the whole family. I'm looking at Alice because I've heard her say this before. Children don't come by themselves. They come with the family. They come with a caretaker, a caregiver, somebody who's responsible for them. So, it's about not just the service to them, to that child, but in order for that child to succeed and progress and become a healthy adult, we have to also address the family unit or the caretaker unit. And so that's very critical. And when we talk about special populations, this, we're talking about not just and I heard this a lot in this group, we're not just talking about the Medicaid population. We're talking about commercial populations, commercially insured populations, but we're talking about all children. Our goal is to provide services and make things available and accessible and appropriate for all children. But there is a special lens that needs to be taken into account for certain populations that have a harder time in receiving services, who may struggle a little bit more. And that is sort of a neurodiverse population, communities of families within low income, non-English speaking families. I can tell you English was not my first language, so we need to remember that there is, a whole community out there where English is not the first language, and they may experience a little bit more barriers to getting those services. So that's what we mean about special populations. We can expand on that. I'm just giving you an example here. But so this is really an overarching framework in all the work that we do. And we wanted it to really tease this out in the strategic plan and really highlight that, because as we build upon, we need to be asking ourselves, how are we addressing the multiple systems? How are those multiple systems impacted? How are we addressing the whole family? And are we missing anybody in this work? The next part of the presentation, we're going to this work. We're not doing it alone. As you all know, we have work group chairs, and we have identified specific. It has not changed after notes upon notes of review. You all are very committed to looking at the system infrastructure in Connecticut. You're all very committed to looking at the services. And within the services is school-based and prevention. Within system infrastructure, it's funding, data, workforce, and governance. So your chairs for system infrastructure are Alice and Jason. So I will give them the floor.
Thank you. Jason says I have to go first because he gets to do the data slide, which is his favorite. The system infrastructure, as Erica just said, is focusing on funding, data, workforce, and governance. We're staying a little bit away from governance right now because we're really looking at who are our partners. We want to look at what's the information that's needed. We're interested in what that output would look like, and then how would we know we have a measure of success. And the partner list, actually, I think you would take this beautiful handout that is in our packet, the advisory body's alignment document, and look at a lot of the reports that have been done over the years. And in particular, really want to shout out the CBHCIAP. I got it correct. I'm going to call you the CIAP group, who laid out a whole infrastructure and have done a tremendous amount of work already. And the system of care group and other groups that are in listed in here, and other things that are not even listed in here. So really looking at what are the core recommendations coming in the past, and reviewing those going forward. So I would count the folks at least the chairs on that as partners. We're also looking at, really getting some conversations going with the private sector insurance companies. Because as Erica said earlier, we're not just looking at Medicaid, we're looking at a whole system, and we have a state that, is a very diverse state in terms of insurance coverage. And one of the things I've been working on with the controllers around the state health plan and what that needs to look like, and as well as really looking at the insurance companies and how are they covering insurance. And then we really need a cost of the delivery services. The CBHCIP did a whole study on financing. We're hoping DCF.
Outside of the school building and that are receiving.
Sorry. We're looking to, get as much information as we can already that's been done on costs, looking on data on grants and return on investments, which frankly on children, you have to think about from multi-systems. You can't just think healthcare costs, because they're not that high. And identify from families and from folks in this room around services that are most helpful, and getting consumer feedback, and really understanding from them what they might need in terms of navigating the systems. And our output hopefully would be improved access, which is our number one goal for infrastructure. Identify through data gaps in services, and frankly, what are the financial sustainability plans that we need to do to be able to build this system, which really goes to the whole multi-systems. There's, you'll hear me say, I think that there's enough money. It's just in lots of different places, and beginning to think about it successfully. Then I think really looking at commercial insurers, either that have a bundle payment or are increasing their services that would match a Medicaid, less demand for intensive hospitalizations, shorter wait lists, less bottlenecking, kids in the hospital, movement of resources away from the crisis towards prevention, early intervention and prevention, and better data and accountability, tracking, making sure that we have key performance indicators, and really that you can look at the data and as anyone, either as a consumer or as a family member, looking at your data. So that's it, right? I have one more.
Oh, no.
Nope, I'm good. No?
Did you do data?
Oh, no. Did I do?
I can do data.
Yeah, you do data.
Okay.
Sorry.
All right. All right. So on the data slide, the data strategic plan and the ideas really come from a lot of the discussions that we've had in our work group, and I think in other work groups, around how complex the children's behavioral health system is, and how many different ideas and opinions there are about what needs to be improved, and how there are big gaps in the data that we have about the system that really are needed to inform what improvements we make. So without going through each point in the slide, I just want to highlight a couple of things. One is that think it's really about the accountability and transparency about services that we have, how effective they are, who they're effective for, who has access to them, how difficult access is, and that we can continue to move from the crisis response and crisis services to, fund a service array that supports all children and gives them services up front that they need from prevention to early intervention before crises happen. And it kind of transitions a little bit into the workforce slide, which I'll describe next. In a lot of the discussions we've had about the the children's behavioral health workforce, is that it is increasingly strained and stressed, and people are leaving. And while there's lots of reasons for that, the priorities here that we talked about are really trying to strengthen the workforce, including through reimbursement rates and funding of services at an adequate level, which I know has been working its way through the process this year. But ultimately, making sure that there's a workforce that's strong enough to provide services, for all the youth and families that need it, that provide services for those special populations or children and families with unique needs, whether it's autism, developmental disabilities, or a range of other special populations, including culturally competent care, which is on here, and that we don't have, or that we reduce the wait lists and the difficulties accessing services for some families. All right, I'll stop there, and you're going to do governance, or are we doing?
I'll do.
You'll do governance. Okay.
Okay, so I think the point of governance ultimately is you can't get anywhere unless there's a true clarity around how it's going to be governed. And certainly Department of Children and Families is top on that list. DSS is certainly with the oversight of Medicaid, the Department of Education, and the Department of Public Health. So I know that there's a committee, the Children's Committee right now, that is covering that in more groups. So in reality, I think the collegiality and the work there is very important. We definitely need to, as I said earlier, identify alignment with some of the other advisory groups that are happening, and create a resource hub, maybe a little more looking at 211, which is our current resource hub, and really making sure that families can get the information needed. We want to have transparent reporting. A lot of us do a ton of reporting, and making sure that that data is clearly communicated, making sure that there's a lot of collaboration. And, my best definition of collaboration is getting people together who are very smart, who know a lot of things, but they can't solve the problem on their own, right? So that's really what we are here, why we come and why we participate, because there's no way any of us individually can do it. And then making sure that there is clinical and functional gains in our children. And as you heard earlier, the outputs will do that. Making sure that there's a CQI, both from data and evidence-based, but also really making sure that there's continuous quality improvement. Is it working for our families? Is this working for our state and our children and families? And try to together collaborate with the advisory boards that are currently in place to support what TCB ultimately comes up with. So thank you.
Thank you, Alice. And now we're going to switch over to our second area, our second strategic priority, which is services. And your co-chairs there are Edith and Jan. And I believe Jan has got the floor.
Hello, everyone. Nice to be with you. So for our strategic priority services, the purpose statement is ensure statewide and local capacity and awareness to provide comprehensive range of affordable, integrated, coordinated, and family-centered services to children from birth to age 22, individualized and within the context of their families, caregivers, and communities. And for services, it's primarily looking at the continuum of care, and within that large continuum, school-based services, are quite important since this is where kids live every day. And then thinking beyond the actual services, prevention to avoid accessing services or the need for services. And we want to assure for the goal for the continuum of care is ensuring a timely access to an integrated system of care that coordinates services across various settings, in-home, community-based, residential, and hospital. And then the 4 categories here are, as you see, partners, information needed, outputs, measures of success. And just to highlight a couple under each one, partners, Department of Social Services and DCF and other child serving departments, healthcare providers, education, legislators, private sector insurance, and data and technology partners. As far as the information, a comprehensive mapping of services across the state, how different demographics access those services are some key areas, and then some metrics to access transitions in services, and the others listed there, which I won't read. In terms of outputs, we want to look at the increased access to services, improved care coordination, promotion of community resources as examples. And the measures of success, first and foremost, is a family's measure of success and they're connected within a community. So looking at community stability and, of course, other aspects of measure. We are also have strategic priorities for the school-based services. Here it's ensuring timely access to an integrated system of care that coordinates services across various settings, again, in-home, community-based, residential, and hospital. Here, partners include Department of Public Health, Office of Health Strategy, insurance providers, and Association of School-Based Health Centers. Our information needed includes data on workforce needs, program funding, which is a unique challenge when you're interfacing with the school and what's school-based and what's mental health service within the school. Models for integrating care better, prescribers, but just globally of integration within school-based care. Outputs, partnership between the state agencies and school-based health centers, finding a way to have a transparent reporting mechanism, retention of staff. And then the measures of success are going to include improved access to data. And I will read the last page, which involves prevention. Goal includes increasing access to preventative behavioral health services and ensure early identification for all children. By the way, we do have chairs for the work groups for schools and prevention, but since they're relatively newly formed, and we'll be collaborating closely with them in services, I'm the one that's discussing these today. Goal, increase access to prevent behavioral health services and ensure early identification of children, as was said. And partners, mobile crisis services, urgent crisis centers, school-based health centers, just the areas that kids are really making contact with the system. Looking at standardized screening, outputs will include identification of early onset needs and measures of success which would show hopefully shorter wait lists, less bottlenecking, increased utilization of urgent crisis centers, decreased lengths of stay in the emergency room, fewer ED transports, fewer mobile crisis referrals. So those are some of the highlights, and I will pass it on.
Thank you. I'll give the floor to Emily.
The next section is in regard to the quality assurance framework. In the strategic plan, you will see this funnel along with a chart on the next page that really shows the funnel of the strategic plan and how it should be inputted into the annual work group work plans, our legislative recommendations, and then again the next year monitor for implementation and revise if needed and establish new priorities to again the TCB legislative recommendations. This should be a cycle that we follow for the 2025 to 2028 years. On the next page, the quality assurance framework in more detail. We want to monitor and refine, identify issues with the process, generate corrective actions, and monitor impact, define how the committee defines success, and monitor impact assessment of TCB engagement, which would include how many TCB stakeholders were engaged, how many meetings were held, how many data presentations were held, how many children and family were engaged, and how was community feedback incorporated in our work.
Thank you. And with the continuous quality improvement plan, I just want to also add, similar to what Alice said earlier, that's us. I just want to be clear that that is us quality assuring our work. We are measuring ourselves. Before we move forward with other things, we need to ask ourselves, did what we just do answer, or did we get it right? Did it answer what we were hoping, or did it resolve what we were hoping? And so we should be evaluating ourselves in this committee and the work and the progress that we're continuing to do. And so it's just something that I feel very strongly about, because we don't want to spin our wheels, right? And so with that being said, the next item on the presentation, I also want to say thank you, Emily and my staff, Jackie and Stacy. They spent hours watching recordings, reviewing reports of the close to, 14 committees that we currently have in existence. Now, hours of reviewing reports from years back, annual reports released, and we have spreadsheets upon spreadsheets. And the goal for that was, where do we align? Let's not duplicate efforts. Where do we align? Where can we collaborate? And this document here, the 2025 advisory bodies alignment document, is exactly that. It's just, we gave you a snapshot of the purpose of this. Was, again, this isn't an I got you moment. It is not that. I want to be very clear. This is more our own level setting, our own understanding of all the work that has been happening, which is great work. It has been very good work. And our goal is to collaborate. I believe that was one of my first statements I said when we met in the fall of 2023, collaboration, and not duplicate efforts. And so how do we do that? And so, as I said, my team spent hours of reviewing documents, reports, and recordings, found the themes, and we then established some Venn diagrams that helps to show where the alignments are in these task force. I should also let you know that we met with many of them. I think we have two more committees that were still to meet, but we've been in contact with them. In meeting with these chairs, tri-chairs, and so forth of all of these committees and task force and commissions and advisory boards, we were informed that two of them have sunset and no longer are active. Again, if you move towards the page 10, begins the Venn diagram, which shows, and by the way, this Venn diagram will change because our work will change throughout the year, and most likely their work will change throughout the year. But the Venn diagram shows currently where we align today. Okay, and we have also, our hope is that we can take this information, and we would love to invite those chairs of those committees, task force, commissions, and by the way, they said they would love to join us, because they feel that this TCB committee can be a vehicle, and that's a term that I remember Representative Exum and Senator Martin Claudio used that term in the beginning of in the fall of 2023. This committee is a vehicle for progress, a vehicle for reform, a vehicle for policy changes and/or legislative changes. And so other committees, commissions, task force, I just keep saying that, as we met with them, they said, yes, we would love to join you, or we would love to partner, or we would love to collaborate. I think it's, again, this is meant to be, how do we find ways to partner? And I believe that now, before we open it up to questions, be mindful of the time. We did, for 2025, as Emily had shared in the quality assurance framework, there is the strategic plan, and every year we will have work plans established. Those work plans are fed through the strategic plan, and as well as any recommendations that may or may not become legislation. Not every recommendation needs to go through a legislative channel. Some recommendations may just be policy enhancements or changes that we work with state agencies on. So with that being said, we do have work plans where we've met with the chairs of each of the work groups. Again, it's just taking what you, Alice and Jason and the Jan just shared, but now just streamlining to what will be the focus in 2025. So I'm going to give the floor to either Alice or Jason just to speak quickly on the system infrastructure.
Thank you, Erica. And I think probably if you all saw all of those different committee groups, you saw the word system of care being used over and over and over again, and all of the different outcomes and a lot of the reports repeat the system of care. And so we're hoping to focus very clearly on the defining what that means when we say those terms in Connecticut, looking at what that means across the country and what folks across the country have been doing. I had the opportunity this morning speaking to a woman who represents state of Ohio and their system of care. So really beginning to look at what that means and defining that. We're absolutely looking at monitoring the legislation. Our recommendation, our number one recommendation was the Medicaid rates, and we've been paying a lot of attention to that and all of the other recommendations TCB did. Looking at the data across access, quality, and outcomes. And UConn is doing some good work. We expect to get some of those reports, data reports. They're also going to do a national, am I right on that? They're looking across the country at other models, and they certainly have been working on that and developing our 2026 recommendations for the legislation then. Is there anything I left off? Or? Yeah. We're trying not to recreate the wheel. I don't know how not to, but that's what we're going to be doing.
Thank you. Thank you. Jan?
Thank you. For the services draft work plan overview, I read the purpose statement earlier in terms of draft priorities, peer-to-peer support, mobile crisis 211 services, consistent monitoring of TCB legislation, continuum, UCCs, ICAPs. In regard to our short-term goals, operationalize the work group, meeting frequency, level setting, finalize the work plan, and reviewing the 2025 legislation. And our medium-term goals include monitoring of TCB legislation. A big project that's been a lot of heavy lifting and communicating about is the UConn Services Array, our project to identify the distribution, to basically want to distribute and monitor response rate and review the results of that survey that looks at the continuum of care broadly in Connecticut. So very important. New on the scene to a degree is a recognition that we probably underutilize or underthink about peer-to-peer in terms of how it fits into the interstitial spaces other than being a direct service itself in terms of holding families together, avoiding higher levels of care, and creating support. Times of crisis is peer-to-peer and getting a better understanding of what works, what doesn't. We'll look at what other legislation is coming down the pipe, and we do work closely with the system infrastructure work group where there's overlap, and I'll leave it there. Thank you.
And now we do have the two, as we mentioned last month and introduced, the two new work groups, which is prevention and school-based. And so we do have the chairs for prevention virtually. I see Ingrid, so I'm just going to call on you, Ingrid.
Okay. Hi. Hi, everybody. My colleague Pam Motti couldn't be here today, but yeah, we're the fairly new prevention work group, and has been mentioned, really our priorities are really about getting evidence-based prevention strategies and looking at emerging trends. But in terms of early intervention, which is really one of our key focuses, we want to look at what's happening around early intervention in terms of the types of screening that are happening, and the populations that are being screened. So our goal is to have universal screening and look at who's doing that. Promoting resilience, emotional well-being through education and community engagement, which one of our members identified as critical, and policy advocacy, and then integrating behavioral and physical health to create a more cohesive. So many of us are aware of the 8 dimensions of wellness and the holistic approach to screening, and then embedding brief screenings in healthcare, schools, and community programs, because the research is supporting how critical early screening is to prevention and reducing and early crisis intervention. And so we want to look at the type of screening to ensure that trauma is also, screening for trauma is also in that screening. Our short-term goals are to operationalize the work group, similar purposes as stated before. And our medium-term goals are, we really want to do a mapping of prevention services, which includes looking at, I think was mentioned earlier, but certainly in this climate, we want to make sure that we know also where the funding sources are for those programs and who their target population is, because when we look at behavioral health, some groups may be targeting universal, some may be targeting kids that are identified in tier 2 or tier 3. So getting that accurate map there. And we believe with our prevention committee members, we already have a lot of that knowledge ready at hand. So we're not anticipating, and then we can do that sort of crosswalk analysis. We want to look at the substance use data results and see, and looking at deeper dive on that. And then how do we integrate our work? We'll work very closely with services and school-based work groups, and then develop a set of draft, if needed, 2026 recommendations. And then, yeah, we're really looking at how can we plan for future use what we're doing and keep this sustainable for subsequent years. Erica?
Thank you, Ingrid. Appreciate that. And now I'm going to give the floor to Dr. Connors. And
thanks, Erica. So I'm here with Katerina Vlahos. She and I are the new co-chairs for the School-Based Services Committee. Something that we provided an operational definition of on our work plan is school-based behavioral health services themselves, just because this is a really multidisciplinary and multi-sector space, and we want it to be really inclusive also for students and families to understand what it is that we're tackling in the school-based work group. So when we're referring to school-based behavioral health services, we're really talking about a full array of multi-tiered behavioral health services and supports. We're including promotion, prevention, early intervention, and treatment for students in both general education and in special education. And these are accomplished through school, community, family partnerships. So our draft purpose here is really just to promote mental health, well-being, and academic success for children birth to age 22. And our goals are really to do that through increasing the reach and quality of school-based behavioral health services. And so we have both reach and quality operationally defined here in the draft purpose statement. We have 2 legislative priorities that we are taking on this year, and we're hopeful to include a 3rd priority with input from our work group and our community members. So the school-based health center priority is really to understand what are the current data collection practices in our SBHCs, what are the opportunities and barriers to having more unified data collection practices, and thinking about how we can harness some more consistent data collection, really to tell the story of the SBHCs throughout our state. There's also another study that we're going to be looking into commissioning, which is a school-based behavioral health services study. That's really focused primarily on billing and understanding how we can maximize the revenue streams and avoid any duplication in billing for our very diverse school-based behavioral health workforce, but also hoping to drive some more multidisciplinary collaboration. So those are the first 2 kind of orders of business for our work group, and we're hoping for a potential 3rd. What else did I miss, Katerina?
I just want to focus on the short-term goals. It is very important to us that we establish the work group in terms of culture and trust. We want to operate under a collective expertise model where lived experience are also included. And we want to be able to set the expectation and a clear understanding of our purpose. We also want to be able to set a structure, to your point, Erica, about quality assurance. We want to be able to gauge, are we on the right track? And if we're not, let's pivot and what that looks like. And so I just wanted to just focus on that for a moment. We do have medium term goals, and you can see this here, providing education in clear, inclusive language to develop a glossary of terms. I know we are talking about SBHC, but how many of our community members can really understand the language that we're using within our sphere of work? So we want to make it equitable language access to those who will participate. We want to operationalize and integrate the work with the services and preventions group, as Ingrid mentioned. Looking at the design of HBACs and monitor and the implementation study that was just mentioned. And just consistently monitor the 2025 TCB legislation and see how we can develop, if applicable, 2026 drafts. And I think that kind of sums our work. Thank you.
Okay, thank you, everybody. We are almost done and we'll be opening it up for questions. I'm going to give the floor to Emily, but before I do also, I want to say, and you may see in the write-up, if applicable, or, and the reality too is that any strategic plan, it is also written in this strategic plan document, we mention a living document. And it should be, it should not stay stagnant. It should be revised and adjusted, right? And then through that quality assurance process, we may have to pivot as identified because of something that's happening at the federal level, at something that's happening at our state level, something. So I just wanted, before we go into the TCB studies, is just to say that it's amazing work that is happening. It's amazing how we've done. I think this whole committee has done a great job of identifying priorities, goals, and strategies, who and what and when. But again, remembering that this strategic plan may need to be adjusted because things also happen, and it needs to be responsive. Just like we want our systems to be responsive, our document needs to be responsive, our roadmap needs to be responsive to those changes. I'm going to give Emily the floor for the studies, the last part of it.
So on the next 2 pages of the document, you will see a list of TCB legislative recommendation studies that came out of this year's recommendations. We are currently working with TCB leadership and convening with the agencies and researchers and work group co-chairs, as they mentioned, and their work plans to develop those scopes of work. So you'll see that here, and there's also in the packet attached another copy of the studies identified.
All right, we are ready to open it up for questions. I would just say the last thing is I believe Emily has identified April 7th as a day for feedback. We need enough time between April 7th to April 16th to then take that feedback and then vet it through the work group chairs, vet it through the TCB leadership and back and forth. Want to say, based off of my experience, if your feedback is not accepted, it doesn't mean it wasn't good. It just means that we had to negotiate, we had to compromise, we had to adjust. And so it does not mean that we didn't read or review or vet your feedback. It's just that it's feedback, and compromises and adjustments would be made. Okay, but April 7th, please email Emily or myself for any feedback on the strategic plan. But now we'll open the floor to the committee for questions.
Maybe I'll start with some comments, because every time you go through it, you figure out new things and it sparks new ideas. So I just want to start with some of the strategic priorities for the governance group. Mostly to call out, I know we're not going to ever be able to list all the partners, but a couple really important ones that I want to highlight in that space is DMIS, given the lifespan prevention work. Obviously, DCF is the core agency responsible for the provision of behavioral health children's services. But when we think about prevention, I think it's really important that we bring in DEMIS for the lifespan and OEC. The other thing that makes me so excited about some of the work and how Alice was describing it with governance, and I share Alice's point that there's sometimes a need to really look critically at programs that have remained as legacy programs or funding that's really spread out across a number of different agency or initiatives that isn't hitting the mark or isn't keeping up with community need in its current day. And so I see this work in governance as being part of identifying that duplication. I love it, identifying it. I want to see us pull that information needed tab around where the duplication is or where something isn't hitting its intended goals and targets and make it a measure of success. So hopefully a friendly amendment that as we continue to iterate on this, we put in there that a measure of success is actually to eliminate the duplication. Let's show our work that we didn't identify it only, but then we actually sunset, eliminated, and really took on duplication. I would also like us to call out a goal and a measure of success being how we refine and sunset things. I think that if something's been around for a really long time, it could be great, but we also have to put a magnifying glass on it and see if it still meets up our expectations for today and where the need is. And if it needs to be refined, we should call out a few programs that we've sort of rescoped, tightened up, or pivoted entirely. And I just want us, if we put it as a measure of success, we'll hold ourselves to that and we'll be thinking of that as we identify the information. But appreciate the excellent work, especially some of our new co-chairs of the work groups. They stood up these new work groups and are already coming up with very robust agenda. So you're right in the TCB culture of things. Thank you.
Okay, let's see. I don't know who was first. So I will start with Mickey.
I agree 100% with what Claudia just said, but I would also like to add in terms of the partners under governance, the Department of Developmental Services. Okay, they kind of always seem to be left out, and they do serve kids, and they serve kids with very complicated presentation. Thanks.
Thank you so much for that. I totally agree. That's really important to add. So definitely so noted. Christine?
I was actually, thank you. I was actually going to raise DDS as well. And so I'm just going to add one thing to that in terms of the information needed and the comprehensive mapping of existing services across prevention, intervention, and long-term care, that we don't want to leave DDS out of that, and looking at what services do they have to offer as well. So I just want to highlight that.
Absolutely.
I had really a process question as I begin to, think about what feedback I might kind of submit in writing before the deadline. And I was thinking about these measures of success, and I'm wondering if the intention is that they are actually measured, because some of them might need some refining if that's the intention, or if they're just kind of conceptual and then, they can probably stand on their own. So the question is, like, how will they be used? And if they are going to be used as measures, is there going to be some kind of baseline against all of these measures that we start with? Because there are like 500. And so I may be exaggerating, but not by a lot. So I just wanted to kind of get a sense of, like, how are we using these measures of success, because they will really shape the kind of feedback I provide about them.
Yeah, and sorry, thank you for that too. And one of the in this quality assurance framework, my team is going through and identifying, creating an Excel spreadsheet, or we already have it, with all of these strategies, all of these partners, all of these outputs, all these measures of success. And one of the things that I envision is that that one of the tasks early on that we do with the work groups is going through these measures and saying, we can't get all this done in year one. Remember, this is a 3-year strategic plan. Now, we could also say that maybe a change that we do in year one may impact a measure that maybe we didn't identify until, year 3 or so forth. But I would like to recommend that with the work group chairs, that's one of those things that we go through this document and identify what's the baseline, right? And are we talking about 2%, 3%? What's the incremental steps to showing that we're achieving these areas that we identified? And with that, we may have to, as was just stated, we may have to refine these measures because they may be too broad. Like these were broader statements, right? These were all, we were brainstorming away. We may have to adjust it and make it a little bit more concrete so that we can be able to measure those incremental steps of success.
Thank you so much. Yes, and to clarify, these were measures that we did in the strategic planning and put there. So this is representative of that. And so they could be way too many, but that's a part of the process when we have these work groups to really kind of weed through and figure out how we plan to prioritize and measure. But it's really an important point. We definitely want to measure our work. Alice?
Just to talk a little bit about that, I really want to call out what Katerina said around, I think it might have been one of the early measures of developing culture and a culture of trust in the work. And I think the kind of work we're trying to do at TCB is not technical, even though it feels like there's a technical part of it. But the reality is, I hope that with this reach that we're trying to do in TCB, which is to be multi-systemic, you're going to get data that is systemically driven, right? You're going to get healthcare data or mental health data or other, and our job, I think, as a outcome would be to really look at the whole picture, just like we just saw with DDS, right? Of course, DDS should be included, you know, and so should our elders, just for the heck of it. Not that we have enough to take on, but the reality is it's our aunties who care for our children, and so our grandmas. So I don't know, there's a sense of holistic look at, and we have the whole family, but I think our outcomes also need to have some sort of soft and I'm a narrative researcher, excuse me, Jason. So, but I think we need to have some real soft skills that are very important to be able to achieve that kind of holistic outcome. And so what are we measuring? Collaboration amongst a multidisciplinary group, collaboration amongst this amazing list of the advisory bodies, pulling that group together for the first time ever, and more. There's a lot more actually in there. So I don't know, there's just a sense of there's the data around the outcomes, but we have to begin to really think holistically of what are the outcomes we're looking for, and think strategically about that. Thank you.
Thank you. And certainly I think we'll have a lot of those conversations and discussions, but it's a really good point. Howard?
So I just want to say congratulations. It was an incredible amount of work. Just two comments. I wanted to suggest that in terms of advisory bodies, that we reach out to the state's suicide prevention advisory group and incorporate them as viable members of this group. And the other thing, with regard to prevention, I want to make sure we incorporate the role of primary care providers, who do represent a huge component of our continuum of care, especially for kids, and are probably continue to be the largest, prescribers of medication for kids who are having behavioral health problems. So their voice, I think, would be really important to incorporate in the work that we're doing. So thanks.
Thank you so much. Those are two wonderful suggestions as well. I can't wait to see all the input and feedback we're going to get, because this is on the spot. This is a lot of data. I mean, it's amazing. I haven't even said my thank yous yet, but and I think that there's so much to just learn from being around each other. But the pediatricians, and I mean, really, that's sometimes the first place you go with a young child. Thank you so much, Lorna.
Thank you. And yes, wonderful job. And I echo all that has been shared so far. My initial comment feedback has already been touched on with respect to incorporating or recognizing the continuum of care and throughout the lifespan. So certainly wanting to advocate for the presence of the OEC in terms of conceptualizing how to move forward. And also with that, with respect to the prevention work plan overview, which is wonderful work there. Just want to, a reference was made to looking into a universal screening, and just want to promote within OEC an option that we do have that is available to all parents throughout the state, and that is the Sparkler mobile app, which is a screening tool. And I think that's important because although that is looking at developmental milestones, as we know, those that are not attended to may turn into behavioral concerns. And so that clearly is a way of promoting prevention early on. And again, Sparkler is available to all families throughout the state of Connecticut. And I think also too, what's so important that we'll touch on promoting the lifespan of development and engagement is family engagement. So wanting to recognize that as well. When we speak of the first teachers that our children are exposed to, it is their primary caretakers within the home. So wanting to support and advocate for that as well. And lastly, with respect to data, definitely agree to the work with data and the importance of data. And Alice, you stated data that is systemically driven. And I feel proud to be in the state of Connecticut because I can use the word systemic. And I also will say proudly it's important to be equitable in doing so. And I think when we look at data, it's not just about collecting the data, but who is interpreting the data. And I think that is where a mindset of being culturally aware, culturally sensitive is very important because not everyone interprets data the same way. So I think that's something to be mindful as well. Thank you.
Wonderful observations. And I had a great presentation recently about the Sparkler app, and I think it's exactly right. Something that you can start very early on. That's this great screening tool that in the 1 year had 300,000 impressions. So I was paying attention, but it's really it's important as a part of this continuum as well. It's right ahead.
Thank you. We're just looking at the strategic priorities continuum of care. And under partners, like for example, in our community, New London, the arts community is a real haven, the faith-based community. And we have this disconnected youth initiative, and our youth navigators, kids with lived experience are doing more to engage people who have fallen through all the cracks. So I think some of the local partners, and again, it's different in each community, but that's something I would add.
I think that's really valuable because we come from different parts of the state and different areas look very different. And I think that will play a role in that. So thank you for highlighting that as well. Make sure we are, I know you're collecting all of this. I don't need to ask, but we have to make sure we're passing this along. Do you have a comment? Any other comments? Oh, right ahead, Edith.
I just wanted to point out, under each of these pages, there's lists of partners. And the danger we run into when we list partners, just like when we create a list of thank yous, inevitably somebody's going to be left off. And I just want to be really sensitive to that. Faith-based community is a perfect example. Some communities, that is a huge, huge partner. So I do think we need to do as much effort as we can to include as many partners as possible so that the trust can be built with those partners.
Thank you. Absolutely. I think that having that deadline and it gives us really time to go through this data. And as we all look at it and give our suggestions collectively, we will have a lot more and still we may miss some, but we will continue to be open and inclusive with who it is with whom we'd like to partner. Are there any other questions? Oh, go ahead.
Thank you. Good afternoon. Great presentation. One of the things that we were discussing, and I didn't raise my hand initially as a partner, but really is a pretty big impact on behavioral health. And those are the social drivers of health. So as we think about housing, transportation, things that can lead to significant health outcome, and how do we incorporate that voice in early, especially in the prevention part of our work.
Thank you. And also really look, I know we touched on it, but just trauma and making sure we just continue to be very mindful of that. Are there any other questions? I just wanted to take a moment and just really sincerely thank Erica, Emily, your team. There is no way that we would have time to comb through the amount of data that with which you're doing this and do our other roles. I think one of the things that is the real blessing of a TCB is being operationalized in a way that allows people who are experts at what they do and you have the time and you understand what it is we're trying to achieve and accomplish to be able to do that and to put us on a path such as this. It is otherwise there's no way, part-time legislature, OPM. I mean, that's not the way. And all these different people in different agencies and people who have all these different roles and jobs would be able to pull this together in such a way. But your level of depth, professionalism, and just honest listening and passion around this, you want this to also be successful. I just really want to thank you. I just couldn't speak highly enough of the type of work that you do. And I just think it's time to give you give them some praise. This is this is a mammoth job, and I can't wait to I've read through some of this, but I can't wait to read through all of this, and we can really dive in and think about it. And please provide feedback. I think it's incredibly important because you highlighted really important things today that we would want to have as a part of this that, we just don't have at this time, but we're certainly open to it. And I also want to welcome our new chairs here, co-chairs, and thank you for taking on this work and saying yes to us. And you made a contribution today, but I really look forward to getting to know you and continuing the work. And we really appreciate this. We are expanding as we identify ways that would be impactful for our young people, for our whole continuum. And I look forward to the part that you will play as well. So thank you for being here. Is there anything else? If not, Eric, I'll turn this over to you.
So I think, well, one, thank you, everybody, because you've spent a lot of hours with us and a lot of hours, and you get inundated with our emails. But that is the way in which we will get this work done: is constant communication with each other, checking in with each other. Where are we? How are we doing? And also, are we in the right direction? And if we're not, that's okay. We just got to pivot and change and make those adjustments. But we will get this work done together. And um, Representative Exum, thank you, and Claudio and Senator Mar, thank you for your leadership. You're always available to us, even though I bug you multiple times. Always available to us to brainstorm and to provide the guidance that we need. And one of the things I do want to say, and just want to point of privilege here, this is a passion work for us and for me, especially. I think you all, some of you weren't there, but this hits home for me because this is personal also. I have 3 young boys. My oldest is 15. My middle one struggles with anxiety and panic attacks. And I struggled to getting services for him. And I was like, whoa, wait a minute. I know that. I think I know the system. I actually don't know the system. I don't know where to call now when you're in a state of panic and you're in a state of crisis and your child is not well. And so that's one. And then 2, I also think beyond my child. I think about, or my children, my 3 boys. I think about our community, and I think about all the young people there, and what can we do to ensure as a state that these young people grow up to be healthy, successful adults, that they can be in this seat and being our next leaders. That is so extremely important for this work. And if they're not emotionally well, they're not going to be able to sit in the seat. If the schools are not providing the education that they need, they're not going to be able to sit in these seats. If the workforce isn't available for them, they're not going to be able to sit in the seats. And so I think it's so important that when we say our children are at the center, they are. The children and the families and the community are at the center. And I truly believe in this work and believe that it can only be done in a collaborative way. And so I want to thank you all, and I look forward to working with you this next 3 years on this plan and making a big success and a healthy community for our children. So
Thank you so much. And I just want to do 2 other things. I want to thank you all for your time, and the chairs. This is a great deal of time and commitment for you as you co-chair these committees. I want to thank you. And then I want to thank the other committees. I see that we have our tri-chairs here from, I always say, the Implementation Plan Committee, who've been at this work for a long time. And we are looking forward to just continuing to partner, because we see on this that it takes all of us. And I understand the commitment, and I do hope that this committee can be really a vehicle so that we can get the work done, because I think all of us have the goal in increase and improving the system. And as Erica said, for me, this was a very personal issue. It started for me there, and like I said, I am not an expert around behavioral health, but I understand what this is to experience in a way that was pretty unimaginable. However, I looked at today, seeing the same person that you couldn't have told me even a couple years ago where we'd be, settling into college and becoming a person that is starting to thrive. And I think it's all of these measures, but it was a lot. It was a lot. It was really, really difficult. Even if you have access, even if you know things and you have a background, it's still very difficult. So it's always like the North Star. How can we improve this system and this outcome and really change and save lives? And so I am very heartened by this. I look forward to fine tuning this and moving forward. And so thank you. Thank you once again.
Thank you, everybody.
I think
You are
with
free.
that, you have an extra 40 minutes. Thank you so much.